Good evening, everybody. This is Eric Tolman doing our second half of our newscast. Thank you so much for joining me today. Our newscast today is on a subject called Mentally Ill Kids Wait for Hospital Beds. This is the story that we have from WXYZ.com, and I would like you to also comment in the comment section below on my YouTube page and tell me what you think on my news channel about this story. Thank you.
In a crisis, they came to a hospital looking for help, but all too often mentally ill boys and girls in our state are being turned away.
It's pretty hard to fathom here, but very real for the children and the parents who live this nightmare every single day. Tonight, 7 investigator Ross Jones continues our series, Waiting for Disaster.
I was home alone with him and his little sister, and he attacked me, and it was behavior that was not my child. It was like I had completely lost my child.
Kelly Miltimore can't shake the memory from that day 5 years ago. The day she didn't recognize her 8-year-old son, Liam. Already diagnosed with autism, that's when he first showed signs that he was bipolar.
He's talking about wanting to die every single day. Mama, I can't take it anymore. I can't do it anymore. He begged me to kill him because he can't take the pain anymore.
And at moments like this, Kelly knows the only place that can help her son is a hospital.
But there are no guarantees when Kelly arrives at the ER. If Liam needed stitches or had a broken leg, he'd be admitted immediately. But because he's a child with mental illness, there's a good chance he'll be turned away.
We were told there were no beds. And so we stayed in the ER all day. We restrained him in the ER.
Day 1 turned into 2, and still no beds. With Liam getting worse, his mom decided she couldn't wait any longer. She started looking herself. Nearly a week after she tried to admit her son to a Michigan hospital, she found one that would finally take him 270 miles away in Illinois.
There is no medical system prepared for these children. It's like archaic, the way that they're treated.
And what happened to Liam isn't unusual. When Kelly Abdullah's son Jacob attempted suicide, she took him to the acclaimed University of Michigan Hospital in Ann Arbor.
It took 24 hours for them to find a bed for him. There was nothing available in Michigan anywhere.
I waited up to 3 days.
And Claude Kinsey's son James has been turned away too. Not just because of a lack of beds, sometimes it's a lack of mental health staff.
There's no words to explain it. We try to get help, and there's not enough help out there. There just isn't.
There is an unmet need in terms of access to inpatient beds.
Linda Zeller is a deputy director for the Michigan Department of Health and Human Services. She says that on paper, the state has enough hospital beds to care for Michigan's mentally ill children. But in reality, she knows that's not the case. Zeller blames a complex set of circumstances that can lead to a waiting list, like a hospital staffing level, each patient's intensity of needs, and even if a child is a boy or a girl.
We need both short-term and long-term solutions to this problem.
Yeah. What is the short-term solution when I go to the hospital today for my son who's suicidal, and I'm told we don't have a bed today, we won't have a bed tomorrow, and there are no beds in the state? What is my short-term answer then?
Short term, we have to work with the broader healthcare community, the emergency room, the inpatient center, the state.
But the state could be doing more to alleviate this problem. It runs its own psychiatric hospital for children here in Northville. The Hawthorne Center can house up to 118 patients needing care, but this year, it's funded to serve only 55. Zeller says adding beds could offer some relief, but won't solve the bigger issue.
Hawthorne beds cannot be the only solution to the problem.
I don't think anybody, believe me, is saying that they need to be the only solution, but if your son is cutting himself and you need to do something now, you need a hospital bed, don't you? I mean, you're not interested in a long-term fix. You need a short-term one right now before something awful happens.
Right, so we do need short-term solutions. We absolutely do. I don't have a magic answer for you because this is a very deep and wide, multifaceted challenge.
But parents like Kelly Miltimore say they're not asking for a magic answer, just a hospital with room for her son. Since Liam's last manic episode, his name's been on a waiting list at 2 different hospitals. He's still waiting, 19 days later.
It makes you feel like you can't breathe. There's nowhere to take your child to get the medical care that they need.
The state has no plans to add more beds at the Hawthorne Center, but there are plans to address part of this problem going forward. Beginning in July of next year, State officials say they hope to open a new inpatient program that can house 12 to 24 children requiring hospital care. It will at least hopefully put a dent in how long these families have to wait.
Wow, that's at least something. I just want to ask you a quick
Sure.
question. Is this really just happening in Michigan, or this is all over? Because you said that lady had to go to Illinois.
It is happening in other states, there's no question. To what degree it might be happening more here, this is a very big problem. You have to wait weeks for a bed. You can't wait.
Oh, it's just heartbreaking.